So, good evening to all the respected dignitaries, seniors, colleagues, and dear postgraduate students. On behalf of the Indian Teachers of Psychiatry and the IPS PG Education Subcommittee, I warmly welcome you all to this special session on what do we need for the Psychiatry PG curriculum in India, findings from a national survey. The session is both timely and necessary. Psychiatry training in India today spans multiple pathways. One can go for the MD courses, one can go for the diploma or the DNB courses. And each produces a psychiatrist who eventually shoulders clinical, various kind of academic responsibilities. So the need of the hour is to reflect together and to move towards a shared vision and see if we can reach a broad consensus on postgraduate psychiatry education, while also respecting the diversity of the training settings involved. Before we proceed further, it gives me an immense pleasure to share a special milestone with you. We are this year, but this particular year marks 15 years of the Minds newsletter, a platform dedicated to psychiatry education and academic dialogue, chiefly by the UG and the PG students, and for the PG and UG students. So, over the years, Minds has grown into a trusted academic voice. It started in 2011 or 12. And our chief guest, Dr. B.N. Gangadhar Sir, Padma Shri Awardee, as well as the former chairman of NMC, has supported the initiative for a very long time. I request Dr. B.N. Gangadhar sir to kindly release the 15-year milestone of the newsletter to commemorate this journey. I respectfully invite Dr. Gangadhar sir to kindly do the honors.
Yeah, thank you, Priyash. Wish you all the best for the newsletter finds. And just as we heard that you have been entrusted with this responsibility, which is rightly so, and you are doing a wonderful job. And the newsletter is deemed released for this function. Yeah, wonderful.
Thank
15
you so much,
years,
sir. Thank you.
I mean, wonderful. 1.5 decades.
Thank
Great.
you so much, sir. Thank you.
All the best.
Thank you, sir, for your words of encouragement. We now move forward to our program. It is my privilege to formally introduce our distinguished dignitaries. As our chief guest, we have today Dr. B.N. Gangadhar sir, Padma Shri Awardee, as well as former chairman of the National Medical Commission. As guest of honors, we have our esteemed office bearers of the IPS, Dr. Savita Malhotra ma'am, President of IPS, Dr. T.S.S. Rao sir, Vice President of IPS, Dr. Amrit Pattajoshi sir, Honorary General Secretary of IPS, Dr. M. Alim Siddiqui sir, Honorary Treasurer of the IPS, Dr. Sujit Sarkhel sir, Honorary Editor of the Indian Journal of Psychiatry, Dr. M. Kishore sir, Chairperson of the IPS PG Education Subcommittee, and Dr. Vinay HR sir from the Indian Teachers of Psychiatry Association. We are truly honored by your presence and guidance. Before we move to the main presentation, we would be grateful if our distinguished guest could share a few words of their recollections with the audience on the postgraduate psychiatry education in India. I would like to first invite our chief guest, Dr. B.N. Gangadhar sir, to kindly share his perspective.
Thank you, sir, for inviting me to be in this meeting. With respects to the President, Dr. Savita Malhotra ji, Vice President, Dr. T.S.S. Rao, other office bearers, not able to see their faces on my screen, it doesn't matter, and all the participants here. I wish you a very warm best of luck and greetings for the success of the ANSIPs in the next week. Coming back to postgraduate education, having served in the National Medical Commission, overseeing the competences, quality of training, etc., etc. Two important observations I thought I will make and let others contribute. There are, of course, structured curriculum, syllabus, reference books list, etc., etc. have been prepared by several groups. Several institutes are actually following a written document of curriculum and syllabus. so also the INIs, although INIs themselves don't come under the purview of NMC, but of course, in NIMAS, I'm aware of the detailed curriculum that was prepared, being there as a faculty for a long time. There are two important observations. Like I said, one is this: there is a curriculum, but the point is it's very variable across all the institutions. It's also variable across institutions who say that they're following the NMC curriculum. This is number one. Number two, uh, the patient load and nature of cases people see are quite widely different across institutions. Those with general hospital psychiatry see a different set of patients vis-a-vis those who see patients in mental hospital or psychiatric hospital settings. Nimhans, for example, or Tejpur, Ranchi, or even Ibhas. The load is nature of patients who see are different vis-a-vis other places. This is number one. The second thing is uh, across all medical colleges, if you take into account, the patient loads have been highly variable. Of course, patient loads are highly variable between government and general non-government hospitals, medical colleges. But even within those medical colleges, whether government or non-government, the load is different compared to some of the institutes which are built on the mental hospital background. These two are different. So it is possible that students may be getting training differentially. So one suggestion which I thought I need to make it is whoever is following any once upon a time, I remember when I joined the MD in psychiatry at NIMHANS, the DPM students, even earlier, were expected to write some 20 case sheets and bind it and give it as a some sort of a thesis or whatever it is, and some record book they were supposed to give. So they have seen 20 cases of different nature, etc. etc. Today, of course, students see a lot more cases. Nonetheless, to go on record, they would be exposed to following types of cases. Also, at least so many cases they would have seen in each of their 3-year MD courses. And also, they should have followed up so many cases for periods of 1 year to 3 years. If this can be put in black and white as a some sort of a quantitative measure, it will be helpful. And of course, skills and competences to be obtained have most of it have been written as learning objectives and so on and so forth. Can we discretize these further into skills that have to be demonstrated in an examination? So the competences, we can distribute a 3-year course into maybe 100, 200 competences, whether they have got it or not. If this can be designed, maybe we would have made it little more. So I'll stop here. I know there are many more senior people who have been associated with PG education for a longer period. I'm sure they would be wanting to comment.
Um, Thank you so much, sir, for your insightful words. Surely we will be taking that suggestion regarding our ability to divide the course into quantifiable competencies. So that was quite insightful, sir. Now, moving ahead, I request respected Dr. Savita Malhotra, ma'am, President IPS, to kindly share her perspective on the topic.
Thank you
Requesting
very
Dr.
much. Yeah, thank you very much, Priyansh. Uh, and I congratulate the PG Education Subcommittee, Dr. M. Kishore and ITOPS and the UG Subcommittee for doing a wonderful job in the whole year. I think this is the first time that there is anything like a survey of PG education has been done in the country at the national level. It's the first time. And I also think that maybe is the first time that we are discussing PG curriculum at the national level in IPS. We have not been doing this, we have not done it in the past. And at the institutional level, of course, NIMHANS, PGI, and all that, we have all talked about the curriculum. but we have not taken any initiative to make a uniform kind of curriculum. I am sure they are not every department of psychiatry or institution has a written document, written curriculum. It was being followed as kind of a understood thing that you come and see patients and so on. But in PGI, that is where I come from, we have had right from the beginning, from early 70s. I joined in 74, and before that, a written curriculum, a document has been there where everything is described, is listed, is written. And these are the objectives, and these are the areas, these are the subspecialties, subject areas, and this is what you have to learn, and these are methods of teaching, and these are methods of assessment, and these are credit hours, and we have a detailed assessment every semester, and so on and so forth. So this is a great opportunity, a great activity and contribution, I would say, on behalf of the PG subcommittee, to do a national level survey. I think we would like to hear from you. What are the main findings? What people think across the country are the deficiencies in teaching? What are the areas of difficulty? Because, as Dr. Gangadhar says, infrastructure and facilities are not uniform across all institutions. There are variations. Some are strong in some are not so strong in others areas. So, how we can cover up those deficiencies? And the whole idea is that students in MD or any PG course should be able to learn what is expected and from the person. So this is great. And in the end, Dr. Kishore, I'm sure you are listening, you are there. So you have now the findings from the survey.
INI and
Yes, INIs. We have had a meeting
yes,
of INIs, and you have
yeah,
had their,
yes,
what they think and so on. And based on that, and also then your subcommittee and using your wisdom and knowledge and
yeah,
everything, we means I'm talking on behalf of the IPS. IPS would like to have from you a kind of a recommended document, a curriculum,
yes,
keeping
ma'am.
in mind every requirement, everything, and
Yes,
also the national priorities, realities, and constraints, and the variations in infrastructure and so on in mind, as to how we can provide the best education, number one, and number two would be a uniform kind of a curriculum. I think students
yes,
should
ma'am.
have a uniform kind of curriculum. It
Yeah,
should not be that a student from AIMS Delhi is far better than somebody from who comes from some other medical college or private college. That kind
yeah.
of a thing should not be there. Everybody should be equally competent and equally knowledgeable. So that is the thing. Thank you so very much for this. I have another meeting. I will log out immediately, and would wait for the your subsequent kind of a action in terms of a document. Thank you.
Thank you.
Thank you.
Uh, Thank you so much, ma'am. Thank you so much, ma'am, for your words of encouragement. This is what keeps us going. We will make sure that we'll be able to follow the objectives laid down by you. Now, moving forward, I invite respected Dr. TSS Rao, sir, Vice President of the IPS, to kindly share his perspective on the topic. Inviting Dr. TSS Rao, sir. Sir, excuse me, sir. Sir, you're currently on mute mode, I think. Yes, sir. Yes, sir.
Congratulations, team, for a wonderful job you people are doing. And my pranams to Dr. Gangadhar. Of course, Madam left the meeting, I think. See, the relevant points have already been brought up. That PG training program is extremely important. Whole range of diversity that is actually present. And maybe 2 decades ago, if we look at how things were actually today, there is something phenomenal changes have happened both in number, that means quantity, quality. Each one actually needs our attention. Possibly many of you might have noticed this. There is a simply book we had published, Psychiatry in India, a training and training centers. Around 212, the first edition, and in 2015, we brought this second edition, and we try to look into what is actually happening in India, academic centers and other centers, and compared to maybe the SARC, Asia, Europe in general, and America in particular, Australia and other countries. In fact, we try to compare, taking the experts, their opinion. May not be a rigorous study, but it had brought into focus how actually the things are happening. So it is actually something very heartening that a survey has been done to understand what actually is happening, say currently, which can make us actually to look into the future and particularly how precisely this can be formalized, uniformity can be brought in, and what we call we can progress. I fully agree that a particular specific document on this properly published and available makes a lot of difference for even administrators also. So I am sure it will be really great, and you'll be really happy that these particular suggestions have been taken up straight away to bring it out. I'm aware of Dr. Kishore and his capacity. Somehow he has that extraordinary capacity of involving people, and he does. He told me there is no excuse for me to escape. I was sitting in the department and I was trying to do. For a little while, I'll disconnect and then rejoin once I'm inside the car. I'm leaving the department now. So this is the only thing. All the best. We are there with you. And the next year, in fact, we want to see that all these type of things are brought up in a big way and properly, and it is available for everybody to look into, to look forward. All the
Thank
best.
you, sir. Thank you.
Thank you so much, sir, for your insight and perspective. Thank you for sharing the book with us. And we hope that we'll be able to live up to your expectations that you have with us. As our next dignitary, we have Dr. Amrit Pattajoshi, sir, Honorary General Secretary of IPS. However, I just received a message from him that due to some unprecedented circumstances, he is currently not available. He'll be joining us midway. Moving next, I invite Dr. M. Alim Siddiqui, sir, Honorary Treasurer of the IPS. I request him to kindly share his perspective on the topic.
Thank you so much, Priyash. Thank you for inviting and following up also, because you made sure that I cannot be out of this meeting. Thank you so much. My respect and regard to all of you, respected Professor B.N. Gangadhar, sir, IPS office bearers, the subcommittee team. I think a useful, relevant topic you are taking. Survey, we are very eager to hear what is there. Everyone will have personal views. So my views would be, in the current PG education program, more of the recent advances in biological, because the psychiatry is progressing more in the recent biological therapies, biological aspects, biological explanations. That seem to be a bit lagging, because the older versions, still the history remains same. The other therapies, everything is there. I think what we are slightly lagging would be more of biological explanation and aspect. That is one. Then I was trained in CIP and I'm teaching in a medical college. So there is a vast amount of difference in the patient population presenting. Because when I was being trained in CMD, in CIP, there were the so-called severe mental disorders were very common in the patient population. It was a tertiary referral center, so those sort of patients were there. And while sitting in community, while doing my clinical practice, most of the patients that I see are of CMDs. So I think this place to place variation, it has to be taken into account. Some portion, some balancing act should be there. The other thing that I found out regarding the research work, the model that we are following is publish or perish. So if you do not do this much of research, it will be a problem. So that leads to a lot of things. Some journals are there who will help you out in certain out of the way, going out of the way. So all these things are there. So if we are able to, instead of pulling and pushing and bringing everywhere there, so if we are able to uh, impress upon the point that whatever the person is going to learn is going to help him society, if this message is passed on, I think that will be a great service if you can do. And our PG committee would be, I think you will be the spearheads of this movement if you are able to do something. So my respect and regard to all of you, and back to you, Priyas.
Thank you so much, sir. Thank you for your words. We will make sure that we'll include your suggestions regarding the biological aspects, as well as the focus should be on learning rather than enforcing the policies. So thank you so much, sir. For the next dignitary, we have Dr. Sujit Sarkhil, sir, honorary editor of the Indian Journal of Psychiatry, the official journal of Indian Psychiatric Society. Uh, Sujit Sakhir, sir. I think sir has not joined yet. So I think we'll move ahead to Dr. M. Kishore, sir, chairperson of the IPS PG Education Subcommittee. I request kindly Dr. M. Kishore, sir, to kindly enlighten us and by sharing his perspective.
Good evening, everyone. My respects to the chief guest, Dr. B.N. Gangadhar, former director of NIMHANS, former chairperson of the National Medical Commission. My regards to the Indian Psychiatry Society President, Dr. Savita Malhotra, Dr. T.S.S. Rao, Dr. Amrit Joshi, Dr. Alim Siddiqui, and Dr. Sujit Circle, who supported. I'm really thankful to my IPS PG committee, many of them who are there, Dr. Veda, Dr. Ayman Paul, and so many others who played a key role in this journey. When it comes to psychiatry post graduation, we have to start with what Dr. B.N. Gangadhar conveyed many years ago. How do we encourage postgraduates to think? That would be the one of the important aspect of postgraduate training. The second is their ability to connect with the patients and their families. That is the second most important aspect. How do we do that? The third is how do we enhance their skills? In competency based medical education, they should have affective, cognitive, psychomotor skill, and each of them should be strengthened at all levels. These are the key important aspects. In this process, we started looking at the opinion of faculty and postgraduates because both of them are equally stakeholders, and we set up numerous subcommittees. One survey was exclusively on INIs. All the INIs, they responded, and it was led by Dr. Agya Pal from AIMS Kalyani. And the discussion has been held, and Dr. Pratap Sharan was the chair for that. Then we put up a committee to look at mentor-mentee program because we know postgraduates these days require mentorship. So we had a committee member, Dr. Pooja Shatral from Gujarat, who looked at, and she has come out with a document on how do we support mentor-mentee program in India to have hand-holding of those centers which are poor in resources in terms of faculty and other things. We also put a committee on super specialty curriculum under Dr. Amit Singh from KGME Lucknow to look at postdoctoral fellowship and DM in addiction, in child, and many other things, so that we have some kind of discussion on those curriculums because they are going to increase by leaps and bounds. The other aspect of what Gangadhar sir was saying, we are looking at some of the professionally entrustable activities, PFAs, we call PEA. And there is a very nice document which has come from the Dr. Kausab Chatterjee of AFMC Pune. What psychiatry professional entrustable activities can be defined, and whether we can take many of them from that is one important aspect. But of late, we also look at postgraduates, whether they have skills in ADCOM, attitude, ethics, and communication. That's a new thing which we are focusing. That is another aspect. And there has been some questions about what do we do to improve theses and research work, as somebody has communicated. There is some concern about what do we do with district residency program, how to make it effective wherever it is poor, how to enhance skill in that period. We have to look at India still has DPM seats, there are diploma seats, there are DNB seats. in India. So how do we work with these postgraduates? So that's one of the reason in this we have given opportunity for all the postgraduates from different programs, MD, DPM, DNB, to give their voice. And we were looking at some of the emerging things like neuromodulation, which is coming in a big way. How do we give time and training for neuromodulation? Then we were also looking at very important aspect which we think psychiatrists should have, the psychotherapy training. So in this couple of months, we have also allowed experts to give their opinion, and we have come out with documents on what should be the psychotherapy training, how much should be it, and neuromodulation is coming shortly. So these are the works done, but Varchasvi today is going to give us insight into the survey, which to our knowledge is the largest survey of that kind. Even though we are talking about institutions which are more than 200, we believe that it represents 60 to 70% of the institutions in India which are offering psychiatry postgraduate courses. So we should look at that data from those perspective, that even if one person has participated from institution, we would have got an insight into what is happening, what is working, what is not working, what do they say. So I'm eager to listen to Dr. Varchasvi's finding today. I'm really thankful to all the people who thought of joining, and we want to listen to the postgraduates also very keenly. That's why in this program, a couple of postgraduates have joined. Unless we join hands with the postgraduates, training cannot be fully efficient. So these are some of the aspects. I'm really thankful. Thank you, Pianch, for making this program possible. Over to you.
Welcome, sir. Thank you, sir, for your insightful words. We have raised a slew of challenges and questions that we face in postgraduate training, like DRP, psychotherapy training, and neuromodulation. And we hope that with programs like these, we can overcome these challenges by reaching a consensus that how can we overcome these challenges. So now moving ahead, I request Dr. Vinay HR, sir, from the Indian Teachers of Psychiatry, to kindly share his perspective on the topic.
Yeah.
Welcoming Dr. Vinay HR, sir.
Yeah, thank you, Priyash. So my regards to all the CDOs and all of the participants in this particular meeting. As you know, Indian Teachers of Psychiatry is a platform created to bring psychiatry teachers together to share their experiences and resources that benefits psychiatry training of undergraduates and postgraduates, which in turn enhances their ability to serve the public. So this platform has been supporting and also the coordinating things in terms of faculty training. And in fact, it has instituted an annual award for efforts in the PG education field. And with the recent award of Indian Teachers of Psychiatry for postgraduate education for the year 24-25 is given for Department of Psychiatry, AIIMS BB Nagar, for their research and initiative on postgraduate module, that is advancing and nurturing scientific writer in every resident. So apart from this, what I would like to stress is that already this survey has included postgraduates who are the key stakeholders. Since CBME has been made a part of our medical education, so it's also makes sense that apart from being learner centered, it's also learner contributed. So that's one thing which is a good about the current survey as well. And other thing is already Dr. Kishore has mentioned about proper alignment of this learning domains with the teaching learning methods and also assessments. With a caution that we need not straitjacket the curriculum as done in UG curriculum, because PG curriculum is a bit different in that regard. So hopefully the findings of the survey reaches its logical end. Best wishes. Thank you. Thank you for your time.
Thank you so much, sir, for your words, insightful words. Now moving ahead, psychiatry as a discipline continues to evolve clinically as well as scientifically. The postgraduate curriculum must therefore prepare trainees not only for the examinations but for the real world clinical settings, real world challenges as well. With this context, it is now my pleasure to invite our presenter for this session, Dr. Vachasi Mudgal sir. He is the member of IPS PG Education Subcommittee and also ITOP STEP Scholar. He will be presenting his key findings on this national survey, highlighting gaps and the strengths and the insight from the survey. I'm requesting Dr. Vachasi Mudgal to kindly share his findings.
Thank you, Dr. Priyash. Is my screen visible?
Yes, sir.
Great. Okay, so very good evening to everybody. It's a pleasure to present the survey findings for which we have convened today as a part of the IPS subcommittee on PG education. Over the last 1 year, we have been uh, kind of brainstorming regarding what changes we could have made regarding the curriculum, the structure, the framework, which could be beneficial to the whole of nation for the upcoming budding psychiatrists. And with this intent, we, under the guidance of the whole committee, including Dr. M. Kishore sir, came up with the idea of conducting a national survey. And I'll be presenting the key findings from this survey. So this survey basically is an analysis of the PG psychiatry curriculum. And we are planning to develop a national consensus guideline, which our respected IPS president also has asked of the committee today to make a document for a universal framework, which will ensure a proper competency across the whole of nation. So it is a national survey on psychiatry PG curriculum, and which is open for all postgraduate psychiatry postgraduate trainees, including MD, DNB, DPM students, to enhance the quality of postgraduate training, psychiatry training in India. This survey is a part of IPS PG Education Subcommittee initiative, and this was supported by the Indian Teachers of Psychiatry Association. The investigators included myself and Dr. M. Kishore sir. So, before we delve into this, like Kishore sir has briefly told us about this, that it is a sub part of the ongoing multiple collaborative efforts and specialized survey framework, which other than this, we have also conducted a few other surveys. Additional survey was conducted focused on the INIs and to capture the high tier academic standards and unique institutional challenges and their framework in the broad specialty of psychiatry, for which the lead investigators were Dr. Agya Pal and Dr. M. Kishore sir. Along with this, there was a super specialty program evaluation, which was dedicated for the analysis of SS programs in psychiatry to carry out and assess the state of post MD training, including the DM courses and post diploma fellowships, with the lead investigators being Dr. Amit and Dr. M. Kishore. And both of these surveys have been already discussed in depth, and will have their findings shortly, and we'll use all these surveys to formulate a certain framework for or a consensus for our MD psychiatry curriculum. These surveys complement the broader PG curriculum data, providing a 360-degree view of the psychiatric education from the very basic foundational course to the advanced super specialty training. So coming on to the objectives of our survey, the first one being that it was made to assess the adequacy of the current MD and DNB curriculum, and to identify certain gaps which included in various aspects, including the subspecialty coverage, including child, geriatric, addiction, and various specialty postings, to evaluate the availability of supervised training for postgraduates, and to gather qualitative suggestions to inform new national consensus guideline. Because there is a disparity between the standard set in and the practical teaching which is ongoing in the national institutions and state institutions, and all the courses which are providing the MD psychiatry course. So we wanted to understand that what is the actual ground level pulse of the MD curriculum. The survey also had the link to view the existing MD and DNB curriculum, which was provided into the survey in itself. These were the links for the MD psychiatry and the DNB curriculum. Coming on to the demographics, the participant profile, we had around 203 participants spanning from across 23 states, which included various north, south, east, and west zone states. And there was quite a diverse representation, which included senior faculties junior faculties, senior residents, and trainees. So we have around 21% of the bulk being made up by professors, 20% of bulk being made from the first year JR. So there was almost equivalent representation from the very ground level and the foundational structure of MD to the very highest level of hierarchy. So coming on to our key findings, the first finding was the current curriculum adequate? And this is our first major takeaway. And most of our respondents feels while the curriculum is the current curriculum is not fully adequate. Only 1/4 of the people felt that it was adequate to continue with this in the future, and there was a severe need for reform. Around 42% voted that it needs a minor improvement. 20% around said that it needs significant improvement, and 30% clearly rated as not adequate. The conclusion being that it is a clear mandate for a comprehensive update to the training framework, which we'll discuss later. Now, trying to reform the PG teaching methodologies, there were questions which were focused on the teaching methodologies. There is a transition from the theory heavy to the competency based training, which is also the focus of NMC these days, that is the competency based training. And this was the very key insight which we got from this survey, that most of the respondents emphasize that the reform is needed across both academic and clinical bedside teaching. So the current teaching is often perceived as vague or too theoretical and lacks clear practical application. When we talk about the pedagogic learning versus the andragogic learning, this is something which we know that as a postgraduate resident, the older methods which were quite usually implied won't work as well, and that is what we have received from our respondents as well, including the faculties. Coming on to the priority, there were 2-3 priorities which came up throughout the survey. The first one being that bedside clinics require quite a huge demand, strong demand for shifting the focus from classroom to ward teaching. Uh, because like we have discussed in the beginning of the session, not every institution has the same level of workload, same level of patient availability or OPD burden. So at a few institutions, due to the lack of resources or patient, there may be a discrepancy. PG needs supervised practice in clinical phenomenology, procedural skills, consultation licensing, and other subspecialties. The second priority focus for the respondents were that they wanted to modernize the academic format, move away from the passive faculty-led lectures toward the case-based learning model. And this was also an input from the faculties, meaning that there were some resources or institutional hindrances which was negating towards a better model of academics. And structured reviews, that is the journal clubs and seminars, should focus on recent advances with practical relevance to the Indian clinical settings. This has been a key finding that our residents and faculties wanted. The researches should be more India based. That is, the textbooks usually provide us with the data. Even DSM and ICD provide us with the data which is mostly belonging to the Western world, and they wanted certain things which would be more applicable to our current scenario. And there was also a priority for formalizing psychotherapy teaching. Only last month we had a national conference on this very topic, and along with that, our survey concurs that teaching must include mandatory supervised hours and psychotherapy case conferences, moving beyond just pharmacological management. In many institutions, during case discussions or conferences, there is a great level of discussion over the case, and when coming on to the discussion, they simply focus on the pharmacological aspect and leave behind the pharmacotherapy based approaches. So there needs to be the shift from the curriculum focus of simply knowing to showing mastery. That is the goal of our Miller's pyramid as well. Coming on to the gaps in subspecialty coverage, there were almost 66% of respondents who felt that the curriculum does not adequately cover the major psychiatry sub-areas, and the areas of concern included child and adolescent psychiatry, and it was quite frequently, almost 40% was cited as needed a mandatory 3 month rotational posting, which is not a norm in every institution. Geriatric psychiatry and neuropsychiatry were followed by that, although NMC mandates that there should be at least 2 months of neuropsychiatry posting, but maybe the ground reality is a little different. And consultation liaison and community psychiatry posting, especially in areas or in institutions which is specifically a mental hospital or a psychiatric hospital setting, consultation liaison may lack, and the community psychiatry aspect, which was tried to be reformed through the DRP posting, is still not actually delivering it in the real manner it was intended to be. The psychotherapy training crisis, like we discussed, that it was a very critical finding that around almost 80% respondents report a lack of adequate training and supervision in psychotherapies, including CBT, DBT, psychodynamic or supportive psychotherapies. And the supervision gap included that the theory was taught. The people talk about the psychology behind stuff, and especially in neurotic cases, what could be the etiology, but there is a severe shortage of supervised hands-on clinical psychotherapy practice. Maybe this is a norm in INIs, but most of the state level government colleges still lack a proper clinical psychologist or a proper psychotherapist from which a training could be imparted or supervised training could be delivered. So it has a great implication that future guidelines must mandate recorded supervision hours, including the provision of infrastructure, human resources, which is required for a proper psychotherapy training. Procedural skills was quite a mixed bag. So, regarding modified DCT, almost 70% respondents report that there was an adequate training in modified DCT. And the analysis shows that the current institutional training is heavily skewed towards biological and procedural interventions while neglecting psychological interventions, like we discussed. And most of the somatic therapies or interventions simply included ECT. Most of the institutions did not have RTMS, biofeedback, TDCS, or the newer technologies. And however, it is a positive that most institutions have this modified ECT, and the teaching is adept for those who are willing to undertake this. So the guideline goal should maintain the standard for ECT while bringing psychotherapy and other relevant and approved somatic interventions for the procedural skills as well. Now coming to the difference between the teachers and the trainees. So this was the differences which we found, that curriculum adequacy was more strongly recommended by trainees as compared to the teachers. So specialty training was more means the lacuna was more understood by the faculties as compared to the trainees, although almost 50% of the trainees also agreed to it. Psychotherapy training was almost agreeable to both of them. Advocacy for therapy reforms was more for the faculties as compared to the trainees. Maybe the reason was that they are not very clear exactly what needs to be done about it. And adequacy of training for ECT was almost equivalent for both the people. So the conclusion being that the mandate for reform is driven primarily by the faculty who identify structural gaps that the trainee may not yet fully perceive. Coming on to the strengths of the existing curriculum, which we could understand from our survey, were that the curriculum provides adequate patient exposure and hands-on training for inpatients, a lot of hands-on experience in dealing with the patient, good clinical knowledge and exposure for the general adult psychiatry practice. The bedside teachings and case discussions were also mentioned as strengths for by almost 20% of trainees and only 12 to 15% of faculties. Comprehensiveness and structure, that it is considered very comprehensive, well-rounded, extensive, covering all major subdomains and important topics. It was described as clear and defined, with well-defined structure and defined competencies, thanks to the recent MD and DNB curriculum provided by the NMC and NB respectively. There was a huge focus on the pharmacotherapy aspect, which was highlighted as a strength, which enables the postgraduate to learn and give correct treatment. There is a little resistance amongst a few of the residents to learn the other therapies other than pharmacotherapy, which may have been a barrier, because many people would want to just continue with a pharmacotherapeutic approach rather than being a holistic psychiatrist. So I beg to differ on this strength. And teaching methodology and quality included that there was a good teacher to student ratio in many colleges, but we have a limitation that this survey, although included a lot of states and colleges, there was a little skewing of government medical colleges as compared to private medical colleges. So that could have been a little different. And there is a strong clinical acumen in most teachers and supportiveness along with it. And lastly, the modern aspects, that is the CBME in principle and flexibility of the curriculum, were noted as strengths. So some respondents also mentioned a good list of syllabus which is provided by the NMC along with the roles and goals of the curriculum. Coming on to the weaknesses, the weaknesses are structural. Primarily, it is the insufficient training in psychotherapy and non-pharmacological interventions with minimal exposure to subspecialties and a lack of formal training in the neuromodulation, rehabilitation, and community psychiatry-based practices. There was a lack of clinical neurosciences and neurology integration, especially in hospitals which do not belong to a general hospital setup. The curriculum has insufficient grounding in clinical neurosciences and neurology, suggesting for a mandatory and longer postings in certain areas, including neurology and associated and allied sciences. So, other than that, there were a few more weaknesses, including the deficiency in subspecialty exposure, like we discussed. There was a variable quality of training and implementation. That means it was not a uniform distribution across institutions, which may be due to the lack of resources, infrastructure, faculty shortage, and lack of objective. Inadequate practical, clinical, and research focus was again a huge weakness, that there is a heavy emphasis in theory and summative assessment rather than, and this was again a good lacuna which was pointed out, that there is too much clerical work being given to the residents as of now and the trainees, and which may impair their bedside and clinical teaching, especially in the, this finding was more reported by the first and second year trainees. And there was lack of hands-on clinical teaching and adequate research training. And they reported that research training, although it is mandated as a presentation and completion of thesis, but the basics of although BCBR is being conducted as a mandatory course for everybody, despite that most of the residents are still not comfortable with how to perform a research. So that was again a key finding of this survey. Lastly, coming on to the suggestions, that there needs to be an enhanced focus on psychotherapy and psychology training, along with other non-pharmacological interventions, collaboration, and recruitment of clinical psychologists, including mandatory supervised sessions, increasing the subspecialty exposure, primarily including child psychiatry, neurology, geriatric psychiatry, CL psychiatry, because these were things which the current trainees were not very confident about while going into the real life practice. There were suggestions, the survey suggests that there needs to be an improvement in assessment and implementation. There needs to be introduction of periodic non-biased feedback, assessment of curriculum implementation during inspections. Since the inspections have been a little not very uniform throughout the institutions, this may again work in the favor of the existing framework and may provide certain resistance to change. So we need to have a proper assessment along with uh, conduction of OSCEs, making the MD exams more to clinical based rather than theory based. There needs to be focus on the foundational and modern topics, incorporating the training on basic science, critical thinking, neurobiology, digital psychiatry, the recent advances including the telepsychiatry and legal issues, which will help a trainee to develop as a more wholesome psychiatrist. There needs to be improvement in training environment and faculties, that is the improving faculty strength, ensuring that they are open to social sciences, conducting a faculty development program for which ITOPS has always been a driving force, and focusing more on the uh, andragogic approach as compared to the pedagogy, and addressing the current staff shortage primarily belonging to the allied sciences, that is the psychiatric social workers, nursing staff, clinical psychologists, and not only simply focusing on the presence of a psychiatrist. So these were our recommendations. we also recommend that there needs to be a standardized logbook. NMC has mentioned that there needs to be a digital logbook, but no uniform structure is provided which can be followed. I have inquired myself regarding the implementation in my institution. So a few of the institutions have told us that they have made their own set of logbook, which is digital and needs to be which requires separate resources along with it, and it may not be feasible for all institution unless it is mandated and a structure is provided by the guiding body. Along with faculty development and external exposure, that is collaboration with private practitioners to understand the real world practice and management along with community psychiatry. So coming on to the conclusion and the way forward, the survey reflects a shift in demand from the theory heavy to skill heavy training. Lastly, we would require the drafting of a consensus document based on these identified gaps, the institutional audits for psychotherapy and subspecialty facilities, and finalizing the national minimum standard which a postgraduate trainee should possess before passing out as a MD or DPM or any equivalent broad specialty specialist. Thank you.
Thank you so much, Dr. Mughal, for that clear and thought-provoking presentation and highlighting all the strengths and the weaknesses that came out of this particular national survey. You have also raised some pertinent challenges that the current curriculum faces, like psychotherapy training with the subspecialty training, the neuromodulation, the community aspect of the psychiatry training, variability in the quality, as well as the inadequate practical or clinical research focus. Now, I would like to open the floor for the additional feedback from our various dignitaries. We value their comments and their insights into how we can achieve the goals that we have towards us and to reach a consensus regarding the PG psychiatry education curriculum.
Let's also give some opportunities to the postgraduates if they are there,
Yes, sir.
because we have to listen to them about what they feel. So if there are postgraduates, I can see a couple of them. If they are there, let them start first.
Definitely, sir. Their comments are definitely welcome. Anyone from the postgraduate students would like to share their opinion and share their feedback regarding the findings of the survey or regarding their own curriculum?
Just to add on, during our survey, we promise to maintain confidentiality, so it will remain the same here. If anybody is concerned regarding that, you are free to voice your opinions.
Sir, you will get honest opinion if there is anonymity, because if you're calling by name, the main points would be missed. So I think we are all mature people. If the residents want, they can definitely tell, because we are trying to change the system for your benefit only. So you have to, if you come out, we'll be able to help you better. Thank you.
I think one of the points which we have not brought out is customization of external postings, whether in PG curriculum, if the postgraduate has interest in child and adolescent psychiatry, whether he can take up the external postings predominantly in that for 1 month or so. So that is one thing which we think will be easy for us to recommend. And in many institutions, they already have strength in particular area. For example, in the AIMS Rishikesh has very good work in sleep medicine. JSS has very high work on sexual medicine. So whether in the postgraduate curriculum, wherever their department has strength, whether they can consider that as an area for postgraduates to utilize those things, and whether curriculum can also incorporate customization based on the region and the institution where they are currently being trained. So these are also another thing we have in mind based on the input from the postgraduates. So if there are some postgraduates, they can please give their input or else we can move to the other faculty who are there who want to give their opinion, if at all they have.
I think we should move towards faculty members in the audience. Um, uh, I request, would Dr. Alim Siddiqui sir, would you like to share your opinions and about how to reach the consensus towards the postgraduate secondary education?
Yeah, I think I have already told that. The thing is, if the residents tell us anonymously, I think that is the best thing.
Yes, sir.
So, uh, the thing is, yeah, if it is practical, if it is of use of long life, then people usually take much more interest. So instead of again the same thing I'll be repeating, forcing on them, they should know what is important, how it is going to change their lives. So then they start paying attention. Because many GRs, when they pass out, then they come to, sir, you were saying correct. At that time, in when we talk of informal field, at that time we were thinking unnecessary. We are thinking about mode and effect and all these definitions and what research we are doing. So it is will be useless. So, but later on they turn around and this. So if we are able to catch that feedback and give to the current JRs, that will be of help. So this sort of mentor mentee programs or the alumni meets, I think that could be one of the ways to move forward.
Thank you, sir. Thank you so much, sir. Requesting other faculty members if they would like to share their opinion or any feedback regarding how can we proceed ahead.
Can I comment a bit on the survey? It was excellent to know the findings. So I was just wondering, one of the finding was that there is a lot of theory focus and lecture focus on the faculty. So I was wondering whether the faculty would, I'm not right now involved in PG teaching, but still I was wondering whether the faculty are really involving in lectures for the postgraduates. I'm wondering. From what I could understand, from the state government colleges, they are the PGs are subject to more and more of their seminars. So every week, I did my PG in an institute, and where we get to do once in 6 months. But when I talk to my colleagues in other colleges, they say every because there are less number of PGs, so there's an overload of PG-led seminars. So that's what that's my impression. But I just wanted to know how the survey had looked at it.
No, I agree with what you said. What I wanted to think is the monotony of the seminars can become active if we bring the learning objectives properly. If there is a very nice learning objective, for example, if the session is on autism spectrum disorder and the seminar is on learning objective, if one skill is to demonstrate how to develop rapport with the child who has autism, then the seminar itself becomes easy for them to utilize that as a model of learning. And let's say one psychomotor component in the learning objective in the seminar is to examine a child with autism to see whether there are congenital anomalies. So that can be done. But unfortunately, our seminars and our faculty have not got tuned to the competency based medical education to make seminars interesting and useful and skill based. These are some of the things. So, and as many people have said, these lectures are more is primarily because the postgraduate thinks when other colleague is presenting, it is like a lecture. They have to listen to the senior PG talking for 1 hour in the seminar, and teachers continuously telling without making it interesting or useful. So that is what I think, and I really accept your view on this lecturing part should be reduced and making it thing. Varchasvi, you have to add anything?
Yes, I would like to add to it. Dr. Kumar, like you said, I think there might have been a little misinterpretation. What the didactic method was primarily focusing on, am I audible? Yeah. So
Yes, sir, you are audible.
what Yeah. So what the didactic method was focusing, like Kushore sir said, that either be it a faculty or be it a student driven seminar, most of the things are simply a lecture or a simple boring presentation, which is very theory based. Instead of focusing on small group discussions, role playing, demonstration of skills, like if you were to talk about catatonia, we would like a seminar to be followed by a demonstration of the BFCRS or examination of a patient of catatonia. But instead of that, there is a already preset structure of seminars, curriculum, which needs to be done every week by a particular set of students, irrespective of the cases which are present in your institution, irrespective of the small group discussions or the ward teaching which is ongoing. So that was the lacunae which the residents and the faculties wanted to focus upon, rather than, like you said, sir, that in the undergraduate section, it is more like a lecture being heard by a herd of 150 or 250 students. But in postgraduate training, the residents would want something innovative, some new method of learning. Like in our institution, in the earlier days, when I was a resident, we also follow the same things. But over the time, we have started to include other interactive activities to incorporate in the seminar, like moderation or adding of certain case minutes, or some brainstorming activities in between, adding a quiz to the seminar. So this may give a little sense of andragogic learning as compared to these didactic methods. So
Thank you so much, sir. Like, we definitely agree with you that we need to update our teaching methods to make them more interactive rather than being simply didactic. Any further questions, or opinions, or feedback from our esteemed audience members, dignitaries present? I think that calls for the conclusion. Dr. M. Kishore sir, should we conclude the session, or do we have any other remark?
Yeah, please conclude.
So as we conclude today's discussion, there were so many chief findings that the survey came up with, all the strengths over there, all the weaknesses over there, and the recommendations like standardization of the logbook, faculty development, and obviously the external exposure. We hope that we'll be able to use these findings in order to devise a framework to come up with a minimum framework that allows us, and obviously with the consensus of all the stakeholders involved. Um, Before closing, I would like to thank all the dignitaries, all the our speaker, all the participants for making this session meaningful. I would also like to acknowledge the organizations that have supported this important academic initiative. The
Dr.
IPS
Piyush,
PG
I think
subcommittee.
Alim sir wants to say something.
Yes, sir. Yes, sir.
I think the examiners who come to take exams and who go to take exam, I think they should also be updated. They should be part of this thing also. Because I've seen people asking, tell me about ICD 10. What is the diagnosis of ICD 10? The child is giving it on ICD 11. So the examiners who are going to take exams, I think there should be some broad, you can say, guidelines or guidance in that also. They should not stick to the old things. They should also try to learn and improve.
Definitely, sir. Thank you so much, sir, for the feedback. Definitely, sir. We need to have the examiners updated as well, and I think that is what we meant with the faculty development. That faculties need to develop and update themselves as well, so that when they go for the examinations, so they are also updated with the current trends and the current standards of the in the psychiatry. So definitely a point well taken, sir. Any other feedback or any other opinion?
We'll have to ask Kishore sir to start a separate program or initiative for training of examiners as well, sir. So would that be possible
Yes,
in the near future?
But Varchasvi, you should also stop the recording. Priyansh.
Yes, sir. Yes, sir.